time. Is your volume? Oh, you're not muted either. Oh, I'm not muted.
Sorry, Sandy, I can't help myself.
You're trying to get the thing I said earlier. Well, we're off to a fine start here. It's 10:04, and we're going to open up the human services. Welcome, everybody. Thanks for coming.
Yeah, then call finance to order and go ahead, Sue.
Okay. Rob, I see you here. Do you want to start with program updates? Rob, can you hear me? You got to unmute.
Okay. Yeah, so from mental health, just wanted to provide the update on transition of services from Glens Falls Hospital to Behavioral Health Services North. I think folks are aware that the Behavioral Health Services North was a new agency identified, new to us. They're currently operating in other counties in the North Country, but they are taking over the hospital's outpatient mental health and substance abuse services, and one of their contracted programs, a family support program through the funded through the Office of Mental Health. So that transition is continuing to go smoothly. We are now targeting for a November date for that transition to be completed. And so just wanted to let folks know that we haven't run into any issues with them. In fact, they're expanding, interested in expanding services, and I think we're very pleased with them and the work that they're going to do in our community. So that was the only program update.
Does anyone have any questions for Rob regarding this changeover? Okay, do we want to go into the 2021 budget? We have Brian here, and he is for finance, and we can get that started.
Okay, we're ready to go with your budget if I figure out what page you're on.
15 to revenue.
15, there we go.
And just wanted to make the committee aware that Harry Carlson, our Deputy Director Fiscal, is also on. So Harry's on the call.
Welcome, Harry.
So if you want to go through your lines and show us what's the same, what's different, and what your outlook is on where we're headed, that would be appreciated.
Okay, Harry, is that something you want to take?
He's got to unmute, Rob.
Okay, John.
Have to unmute. Harry, can you unmute?
Okay. Could you repeat the question? I didn't really get it. It's sort of garbled.
Harry, we're going into the budget for 2021. We're
okay.
On page 15. We're going to go line by line if you can explain and help us understand.
Okay. Yeah, the budget for 2021, we're anticipating pretty much a fairly same here, same in 21 as in 20, as far as the expenses go. There are a few bumps, and as far as like the salaries, we had one union worker that was getting a salary increase for 2021, but the rest of the staff stayed at 2020 salaries. We actually reduced some costs and increased slightly some other costs. Like the rent there, it's got a 2% in there. And as far as the state aid that I did note, we included the projected COLAs, the annualization of the COLAs awarded in 2020 into 2021, but who knows if they're really going to be approved, because we are still getting holdbacks on the advances that we don't know if that's going to be made permanent or not for next year. But I did budget it as if it was going to happen and stay as is. Probably the biggest thing that we got hit with, unfortunately, is the loss of the district monies. We got some, I think we got about 4,000 this year. Last year, I think we got like 60 each county, and we don't anticipate getting any more. We don't anticipate getting any more this year for 2020, and zeroed it out in 2021. We were getting it for 4 or 5 years, and the program just ended, unfortunately. But everything else was fairly constant, no big jumps one way or another. So that's basically it. That was probably the biggest thing, that loss of revenue source.
Thanks, Harry. Does anybody on the board have any questions about Henke?
Yeah, on the state aid, you're showing a slight increase to less than 1%, but I was wondering if, with everything else in state aid dropping by 20%, is that a reasonable number?
For the state aid?
Yeah.
As far as we know right now, given the COLAs and what we anticipate getting next year for some of the, the program changes, or the like the alcoholism, that type of thing. But right now, that's our best estimate. Again, given the situation now, we really don't know. I think we're expecting cuts, but what they're going to be and when they're going to be instituted, we really don't know.
Crystal ball?
Mr. Henke raises a good point. It's probably going to come up repeatedly with our departments today. So the budget officer and the treasurer and I had a lot of conversations going into the departmental request process, and I think Mr. Henke make a very good point. We don't know what's going to happen with the state funding, right? And at first, if we go back to April and May, we were convinced we were going to get cut 20%. The governor said it could be as much as 50%. The cash report for the state that came out August 30th, not that bad. His cash position is much better than it was. His revenue forecast is $1 billion stronger than he forecasted it would be. The Federal Reserve just came out 2 weeks ago, put a report in that said that the hit to GDP from the shutdown in the first 4 months of the shutdown are an order of magnitude lower than they thought they were going to be, right? So the signs are starting to look a little bit good. If the federal government actually did something, the state's not going to be that bad. With all this uncertainty swirling around, what the budget officer and Al and I kind of directed the departments was, unless you know for sure that you're going to get cut and how much you're going to get cut, essentially plan for flat funding from the state. The hope would be, following the election, the feds will do something one way or the other. The governor came out last week, or Mojica came out 2 weekends ago and said, we're not going to formally cut anybody until the feds do something so that we know how this is going to trickle down. Around the election, after the election, by the end of the year, at some point, the feds will either do something or not, and the state will have to react. What Brian and I have talked a lot about is, rather than slash and burn our way through this requested budget without really knowing what we're aiming for, let's be as conservative as we can. Let's forecast for flat revenue. And if we get some certainty that, okay, you are going to get cut 5% or 10% or 15%, whatever it may be, we can work really hard the last couple months of this year to put in what those contingency plans are and how we're gonna balance the budget, so that January 2nd, when you all get together for your organizational meeting, we can have a giant omnibus budget amendment ready that will codify whatever certainty we've been able to attain at that point. So I think your point is very valid, spot on. What we've talked about at this point, if the board is comfortable with it, is keeping the funding flat till we know, then we'll react.
Okay, that's why we reacted in the budget to the chip stuff, because we knew that was down.
Because we had that in black and white,
Okay, I got it.
right?
Yeah.
And it was more present because it was current year expenditures.
Right.
So this time, we don't have anything in black and white that we know is definitive. And to Deb's point yesterday, there's still a chance, because this is kind of what we've started to see in some other funding streams, where that 20% of chips that we held back on this year to try to be conservative may end up coming through. The good thing about chips is we can roll that forward to next year and do more paving next year, right? But we felt like we had to be more conservative in that because it was present year expenditures. These that we're talking about now, I think we can be a little bit more rosy, plan for flat, because we still have plenty of time to adjust if changes come down the pike.
Either way, up or
Yeah,
down.
up or down, or, you know.
Okay.
Very good.
Also,
Think of
the
them.
thing with the state aid is if the state cuts, most of the state aid goes to the agencies through contracts. So if it is reduced, whatever point, then we reduce the contracts. And that, that would cut the expenses also.
Okay. Alma,
That's what I was gonna inform the committee. The thing that's specific about this department is we only send what we get. So to Mr. Hankey's question, if this state aid was cut, the expenses would be cut by the same amount. It's the one department where we only send what we get. So just, Harry just mentioned that as well.
very good. Any other questions for our mental health folks? Very good.
The other point I would make is just to draw attention to the psychiatric expense line.
Oh, I thought it changed.
Excuse me.
It's better and different.
What page you on?
So the psychiatric expense line, we do anticipate, we did put in the 35,000 because historically that's what we've landed on in discussions with the Finance Committee and with the Human Services Committee. But, the state did change the formula for this expense, and there was a cost shift to the counties. Previously, the counties were paying 50% of the restoration costs, and now the counties are responsible for 100%. So I don't have great confidence in this number. I think we're
Well,
running.
that's good, Rob, because Chris and I didn't either, and Chris actually changed it to 100, so go ahead, Chris.
Great minds think alike, Rob. So
Okay.
we respect that Rob did exactly what we told him, tried to keep everything flat. He put in 35 for that, which has been our historical. As the board remembers, we've blown through that the last couple of years. Between our immediate couple past years' experience and that funding shift, we put $100,000 in there, just because it's one of those things that when the cost is the cost, it's ordered by the courts, we've got to pay it. We may as well try to appropriate for it. So, yeah, totally agree with you, Rob.
All right, thank you.
Hey, thanks ever so much, guys. Appreciate it as always.
All right, thank you.
Thanks, Eric. Thanks, Bud. Okay, now we're going to go into, is Ken on here, Ken Winchell? I don't see him. We're gonna go down into Mike Ray, I saw you on here. Sorry about our phone issues yesterday. You gotta unmute.
There he comes. Maybe.
Thank you.
Can you hear me okay now?
We got you, Mike.
Perfect.
All right, good morning, everyone. So I'll go over my forecast for 2021. Page 19 and 20 is the revenue. And the difference between 2021 and the 2020 adopted as less, $60,500 less. That's due in part to our last year of funding for the Safe Harbor program. Those dollars flow through the DSS and they contract with us. The Safe Harbor program is a program that serves youth that have been identified at risk or have been sexually exploited. Historically, the state, after a county has completed their 5-year cycle, has issued sustainability funding to continue, not at the level, the current level, but some counties received up to $25,000. I inquired about 2 months ago as to possibility of that, and I've yet to hear anything back from OCFS on that. So I didn't include any of that revenue for this 6th year. My intent is to continue the program, but I am joining that program with a JCR program coordinator. I'm not backfilling one position. I'll get to that under expenses. But the JCR program coordinator, almost 40% of his caseload involved youth who were sexually exploited. So we feel it's a good fit. We can meet the needs, and we will continue to monitor it. In the future, if there is funding or the need increases and we're not able to meet it, I'm going to come back to the board and talk to them about that impact. So that's why you see the decrease in $60,500 in our projected revenue is directly related to Safe Harbor. There are opportunities for maximizing federal reimbursement. I've been speaking with Tammy about the possibility of potential come in the future. Like we have in the past, we'll continue to collaborate to maximize that to meet local need. And there's also a small portion of some of my state aid that is discretionary that can be applied to fill gaps in funding when it's appropriate and necessary. So that's really revenue in a nutshell. Are there any questions on revenue?
Nope.
Okay, I'll move into expenses. So, and expenses sheet is on page 85. 85, 86, 87. So we were able, by not backfilling one position, I didn't count any of the legacy costs, any fringe or anything, but overall, we were able to cut expenses by $37,000 from last year. That's by tweaking different items. I don't know if you want me to go line by line, but I cut pretty much as with the discretion being that what I know could be manageable and the opportunity for future funding. So that's really where we're at. Is there anything? Do you want to go line by anything, or I don't know.
Not necessarily unless somebody has questions. If anybody's noticed anything they want to ask about, we'll do that. But Alnolette, you had something?
Mike, if I could just ask about that, the personal services real quick. Are you actually removing a position from your staffing pattern, or you're just budgeting not to fill one for the entire year?
I'm not removing it from the staffing pattern until I see what potential funding is, Al, and also what the impact is. I'll come back to the committee and request a backfill if needed, but I did not include that position in this budget, no.
Okay, so if you do come for a backfill, we would also have to get the funding in place as well?
Absolutely.
Okay, thanks, sir.
You're welcome.
Next.
Don't we match the budget to the staffing pattern? If the staffing pattern has that position, we budget for that position? So
That's what we try to do.
Backfill, they'll still be in the staffing pattern and it should still be budgeted for. Philosophically.
Yep, philosophically, and I think maybe as a compromise, what we could do is, I very much like Mike's approach to this, right?
Mm-hmm.
And we don't want to penalize him for that. The last thing we do as part of the budget is the adoption of the staffing pattern. So that would give us all the way until November for Mike to get some certainty on that funding. And then what we could do is, at that time, either include along with the associated funding or remove it from the staffing pattern, but again, with that conversation of the board that if Mike's able to secure additional funding for this and he has the programmatic need, it would be a discussion we would have at some point next year.
And then just.
We would amend the budget to realize the revenue.
Yeah.
And then change the staffing pattern to backfill that, not to backfill it, to create a position.
That would come in our amendments for next year after the fact, if that was the case.
As I was just laying it out, the position would be on the staffing pattern until the last minute. So if Mike were to achieve the funding or realize the funding, it would be an amendment to the tentative budget, but no change to the staffing pattern. If he's not, it would be no amendment to the budget, amendment to the staffing pattern at the last minute prior to adoption. Then, if subsequent to that, in December, January, February, he were able to get it, it would be an amendment to both at some point next year.
That sounds fine, as long as they're matched where it's supposed to be.
Yep.
And
Yeah, thanks, Mike. That, you know, it's the best way to look at it under the situation.
Yeah.
all right,
Appreciate
thanks,
it.
Frank. Thanks, everyone. Appreciate it.
Mike, you're all set?
I'm all set. Thanks, Sue.
Yeah, thank you. Okay, so we're gonna go down into public health. Is Patty, oh.
Hello.
She's masquerading as KJ.
Yeah,
Yeah, her computer's louder, so we decided to use hers.
Oh, thank you. I appreciate it. So you're up.
Good morning,
Okay,
Patty.
good morning. I do have a couple of items before we dive into the budget. The first are a couple of purchases we'd like to make through the lead poisoning prevention program. We are still trying to limp along to maintain the dictates of the funding. And there are a couple of outreach efforts that have been successful in the past that we can do amid the current demands on the department. We'd like to purchase or repurchase paint paddles with lead messages that we distribute to the hardware stores and home improvement stores. That would be an expense of $110 and freight. That would be one item. It's 100% covered by the lead poisoning prevention funding. And the second are seed packets that we use for spring outreach to promote appropriate nutrition, high iron intake in a lead environment. That's about $40. And that gives us 500 seed packets to distribute to the food pantries, Head Start, community outreach areas.
Thank you. Do we need a motion to pass that through?
Move it.
Okay, Brian and Jay, second. Thank you very much. All in favor?
Aye.
Okay, that is good.
Great. Thank you. The next item is a personnel request for this year. It's actually revisiting a request from last November. I did get permission through the Personnel Committee on November 5th of 2019 to backfill a infection control nurse position due to a retirement we had on November 14th of last year. With all that's been going on, we have not been able to recruit the position. It had been a grade 21, which is a mid-level supervisory position requiring a bachelor's degree. We currently have an infection control nurse. We had two positions in that same grade and title. They back up for each other because not only do they do our preparedness coordination, preparedness planning, they also do our communicable disease follow-up outside of COVID. So any communicable disease that are reportable to the state, STDs, anything like that, that responsibility lies in that position. Over the summer, with our cases being down, we had a moment to think. And what we're proposing and requesting at this time is backfilling it, not with a grade 21 supervisory position, because I do have a mid-level in that position. I have an advanced degree nurse, actually a master's prepared nurse that can provide guidance and fulfills the state requirement. We would like to add a registered nurse that would be tasked with backing up and working with the current infection control nurse. So that would give me, it would be a change in staffing pattern, but it would be an overall cost savings in a position we desperately need. And we have had to rethink because we can't attract bachelor's prepared nurses. So that the staffing pattern change would be, I would propose decreasing the grade 21 position to 1, and we currently have 2, and adding 1 RN professional registered nurse position, giving me 4, which provides some flexibility for coverage. And then that nurse would be assigned duties working with the current grade 21. And I would like permission to backfill this year. We're in need because in absence of that nurse, it's Kathy or I filling those needs, and it's hard to do an Campylobacter when we're dealing with everything else. So that would be my request to go to personnel.
I'll move it to personnel.
Okay, do we have a second?
Second by Daryl.
Paul?
Daryl, Paul, down, you got 'em all.
All in favor?
Aye.
Aye.
I have a question of Patty.
Yes.
Patty, this is Daryl Wilson. So a little bit about the chicken or the egg, or, based on changes, recommended changes to staffing pattern, it's conceptual now. We kind of can sometimes drive our staffing pattern based on the availability of what's out there that we can fill. Is there some concern at your level that you may be moving in a direction that you are forced to move in, but don't necessarily or wouldn't want to move in if you didn't have to?
I believe this would work. I know the position had been vacant for over 2 years before we were able to attract the nurse we currently have in the position. And I cannot go 2 years. I can't, it'd be hard to go 2 more months if we can at all help it. So I think this will work. It will give us some flexibility in our RN staff. And, I think it will fill the need. It's going to be difficult going forward to find nurses with the degrees we need. But at least right now we're able to do this. And I think it will allow us to get the work done we need to get done.
Thank you, Patty.
You're welcome.
Does anyone have any other questions for Patty regarding staffing patterns? After this vote? Okay, Patty, do you want to go to the next?
Sure. I do not have any miscellaneous for you. So I guess if you're ready, I am to go to the budget.
Okay, before we go on to the budget, I just want to take.
Did you vote on that, Sandy?
Okay.
Did we finish the vote, or did we just?
Yeah.
Okay.
I want to take this time to thank you. I think that department over there is like a Super Bowl in a room. You don't know where you're going to go next. And I don't know Washington County and Vermont, if you're involved in all that. God bless you. Okay, keep up the good work. We're all behind you. Okay? So thank you. Now I'll pass it off to Clark.
Yeah, so we're all set to go, Patty. I think we're at page 13 with your revenues, I believe. I got the page right.
Okay. So starting on page 13 with the children with special health care needs, we really, just an overall comment is most of our budget projections are based on 2019 expenses and 2019 revenue because 2020 is a complete anomaly for us. There's really nothing that has been normal. And programmatically, we're doing what we can to have, to maintain the grant funding. But you'll notice when we're comparing, and I'm sure it's not unlike other departments, really 2019 is a better comparison for us related to that. So with that said, the children with special health care needs, really the increase in revenue is projected due to numbers. It's dependent on the numbers in the program. So as our expenses go up, our revenue tends to go up. We have 59.5% back from the state education department on the expenses. And most as you know, these costs are generated from students' tuition, evaluations, and it's very dependent on the numbers we have. So we do anticipate an increase there going forward into 2020. Includes Medicaid. We did have a bump up. You'll see historically, we did have a little bump up because of the change in Medicaid rates that we presented to you a couple of years ago.
Okay. Very good. Any questions on revenues? We'll move on to expenses. Page 71, maybe?
All right. $71. 2960, right? Okay. I'm sorry, on my page, it's page 50. It's the 2960 account, Children with Special Healthcare Needs, that goes with the 3 to 5 program. We did not have French last year. Those numbers I can't explain to you. I don't know if you want to have any discussion or just move on to point twos.
We'll skip right over that. Yeah, we will.
Okay. Basically, overall, unless you have specific questions, it's fairly consistent with the budget presented prior. Again, we anticipate increases related to evaluations. It's very child number specific. We're not sure what kind of rebound we might see going forward based upon the fact that there were programs minimally operating during the course of this year. Children had not received, they're starting to pick up now, but had not received some of the routine visits that normally generate referrals to the program, and schools were shut down. So in this program, the Committee on Preschool Special Education really drives the process, and schools had been shut down. So these are all based upon, anticipated numbers or our best projections of numbers, primarily related to 2019 and what we know currently about 2020.
Okay.
And transportation, you'll see there's an increase there. That's based upon the typical increase that we see.
Alma, you have a question?
Patty, there's a $115,000 jump in your contract expenses. Do you have something new coming on board?
Nope, those are evals and they're number specific. So it's the numbers of children we're anticipating coming through the program. And that's the expenses we pay for evaluations and supplemental evaluations to the preschool programs.
Okay.
Very good. Now we're on to 71, is that right, Patty?
Okay, so you want to do public health revenues first?
Yes, we could do that.
Okay. My numbers, I downloaded the worksheets, but my numbers seem to be different. Our revenues for 40004 start on page 13 in my book, but it may be different in yours.
Oh, you're probably right. It's each different department of public health is what it is, Matt.
All right.
Yeah, she's got like 12 departments.
Yeah.
Crazy.
Go ahead.
So 40004 is public health. Again, it's pretty consistent with what we anticipated in 2020. These are expenses or revenues we get generated from nursing charges, so our home visits, self-pay, individuals to clinics, chart copying, donations, rabies clinics, things like that. Are the other public health income, immunization income is related to the billing we are able to do with third-party health insurance carriers for children who come to the office for routine childhood immunizations. So we do anticipate that's, business actually is picking up as schools get underway, because children are required, even though they're fully remote, in some cases, to be up to date on all immunizations. So we have seen increased traffic in that area, and hopefully we'll make some of that up. So we do anticipate that being similar.
Okay.
Okay. Going down to state aid, public health work. That is our 500,000 base state aid grant, and 36% of costs over that. Right now, an imminent threat to public health has been declared by the commissioner, and we're able to receive 50% of costs in excess of our base grant. I don't know how long that will continue, but we do anticipate it continuing at least through the end of the year, as long as COVID remains, and we'll have to see after that. The other, our rabies and lead grants get included in there, and all indications are that will remain flat. We have not received notice of any cuts to state aid to health departments at this point. Going down to federal aid, federal aid for public health works. This is our immunization and grant funding. It's a federal pass through the state. This does cross fiscal years, so money is moved accordingly as we go into other years. We anticipate, again, that will be flat funded. We have not heard anything different. The bioterrorism disaster preparedness federal aid, that gets added, as does the next, or as we get that approval and we know exactly what we're getting. So once our grant packages are approved, that money gets added in. We have not received any word that that will be cut, so it should be similar to prior years. We just don't know specifically at this point. And finally, the last is DSRIP, and that has come to a conclusion.
Okay.
Brian,
Yeah, go ahead, Bob.
on the immunization income, does that have to change the first deal if you get a COVID immunization that you guys wind up having to administer?
That is a possibility regarding COVID administration. We've been told to prepare for that. But I believe that would be a separate funding stream or a separate process outside of the immunization action plan. This is specifically for childhood and adult immunization for those who qualify.
But that's mostly that's third-party stuff, right?
What's that?
Is that usually third-party billing or something where that comes from?
There is some third-party billing, but that line reflects the federal monies we get through the CDC that are passed through New York State.
Okay.
Proceed, I guess, Patty.
Okay, so 4004 expenditures. In my book, it's page 71.
Yeah, we're right on.
Okay, the point ones are reflective of the increase, the 2.5%, steps, longevity, and then the buyout and incentive lines, as we do anticipate retirements next year. As you know, 85% of the public health staff is of retirement age. And we are anticipating, although I don't have paperwork in hand, that this will be occurring throughout 2021.
Okay.
Again, point nines, I'm guessing will continue.
Yep.
Okay, so our point twos, that's typical, standard. We do budget a little bit of money in there, basically for repair and replacement of any equipment associated with the public health department. Our point fours, fairly consistent, actually. with a little down from last year. We have decreased some of our printing costs. Our postage is fairly consistent. We do have some slight increases in our dues and subscriptions. We belong to the New York State Association of County Health Officials, which is extremely valuable, the Home Care Association of New York. And those dues are really dependent on a calculation based upon, there's usually a slight increase, but it's really based upon our population. And a slight decrease in printing as we become more automated. There's a,
Go ahead, Al.
Brian, it's a very small thing, but under the new procurement thresholds, $200 wouldn't be a 0.2 anymore, so that you might want to move that down to a 0.4. You got $200 in your equipment line. Something of that level wouldn't be a 0.2 anymore.
Very good.
I guess the only other thing is, the last line is our bioterrorism preparedness grant that we'll bring to you for recognition once all the paperwork and planning is approved.
Any questions for Patty?
I have one. Patty, again, Daryl Wilson, thank you for all the hard work you've been doing here, not only with the budget, but keeping us safe. The question I have is based on this budget, if we assume that, and we know this being fact, I think that COVID's not going to go away. We're going to be battling it for a little while here, particularly in the 2021. What part of this budget is of most concern to you? Where do you think, by staying flat, where do you think we're most at risk?
I think our biggest risk lies in personnel. I'm concerned with personnel. We are taking advantage of every supplement to our current personnel we can. We're part of the New York State contact tracing system and something called ComCares, which has helped tremendously, especially with the numbers of people and travelers we have to keep track of. That's more than 50% of our people in quarantine now. They're can be, some are very good, but some can be very difficult to keep track of. And, we struggle with the day-to-day management of that, but they've been a great help. We've also been offered a school health specialist that we've taken them up on, and the state's going to be, and this is on the state dime. So these are helps that we're able to get without burdening the county taxpayers that have been invaluable. We're still waiting for the school health specialist, but I think my biggest concern, especially going into 2021 and the potential of individuals departing, is maintaining a staffing level that's adequate to serve the needs of the community, and being able to recruit and retain nurses in the current environment, where we're competing with hospitals, health centers, things like that, where they operate under a very different system where there's bonuses and incentive payments and pay for performance and, things as a government that's very difficult to compete with. So I think overall, I think we can control our expenses based upon what we get for revenue to the best of our ability. We tend to do that. But my biggest concern is maintaining appropriate staff and staff that have the credentials that are needed, that we're required to have.
Brian.
Thank you.
So Patty, in recruiting personnel, you talked about the difficulties over many years in attracting infectious nerves people because we needed RNs. is that gonna be the same with your other staff? If we need RNs, we're gonna have difficulty recruiting those? And would we have to look at evaluating some of those positions to fill those with LPNs? I'm just reaching out to figure out what the challenges you see are.
Yeah, the minimum base for public health is a registered nurse, because they have to have assessment skills that only come with that type of preparation and degree. So we typically can't use LPNs or community health workers in isolation. So that will be difficult. The state does require bachelor's degrees or more advanced degrees, depending on the position within the department. And that has proven difficult for us. Like I said, we had that one position open for 2 years. And we did it, we advertised through nursing schools, from Binghamton to Plattsburgh. We worked with the directors of nursing. We advertised in Albany papers. We advertised in, different ways up here. Melissa provided some direction. We did some online work. And it was very difficult. The way we were able to attract an individual is really through word of mouth. And we had actually one of our school nurses refer our current nurse to us. So we really were very lucky. As far as attracting RNs, we haven't had the need to advertise for them at this point, because we really have had long-term staff, especially as we decertified the CHA. We had a process where our most senior RNs who had a lot of time in and were very invested in the position and had a lot of investment in their time here that stayed. But as we move forward, and being perfectly candid, the year we've had has been very difficult for staff. It's been very challenging, and it's been very challenging to deal with the public in some cases. We've had some wonderful experiences, but some not so wonderful. The workload is unrelenting. We're still on a 7-day-a-week stance, although we don't have all staff reporting to the office any longer. And we've only been able to do that because we've been able to secure support from the state through the ComCare contact tracers. That's the only way we don't have our entire staff still on a 7-day-a-week schedule. So, we can certainly look, again, our experience looking for an RN with an associate degree. I haven't done that in a while. We haven't advertised for that in quite a while because of the way things fell out post decertification.
Okay, Patty, is there any opportunities, even though they may be limited, with any of our people that would have left as traveling nurses or Pleasant Valley that might, some there might have been hard feelings and hopefully they've gotten over them now, but we did what we had to do, and thank God we weren't trying to running a nursing home during COVID, because that might have been a little bit tough too. Any of them that might lack retirement time that might be willing to come back to fulfill their years to, for their state retirement, is there some possibility there too?
I don't know the answer. I do know when we were looking for people to kind of bump up our staffing over the springtime, I guess it was springtime. I'm kind of in that bubble. We were able to have 2 or 3 nurses return, but they haven't chosen to come back. We did survey again in anticipation of the potential that we would get very busy again in the fall, and they weren't excited, although they said if we truly needed them, we could try and call them again. But only one of the 3 would said that she would consider returning. The others, I think, they're done. They're busy. They were busy. They were facing a lot of people are not very nice when you tell them they're quarantined. Not everybody, but there's many. And many of our nurses have been called names that would make a sailor blush, and I'm married to a former sailor. We, administration, have been called names. It's not easy work. And oftentimes the good does outweigh the bad, but it's the bad that weighs on you heavy. So we're doing our best, and we'll look at all avenues as we have in the past when it comes to recruitment.
Well, just to reiterate the way the whole board feels, we appreciate everything you guys have done over there. It's been a trying time all the way around.
Thank you. We appreciate that, and I'll pass that along to the staff.
Okay. Anything else, Patty?
Yeah, there's more budget stuff, I'm sure.
I have another at the end too that I forgot.
Okay. Go ahead, Patty.
Okay, where are we? Continuing on 404 or 405. I'm still on page 72, correct?
Yep.
Okay, 405 is our family health. That again is through our Article 6 program. No big changes there, a little bit, a slight dip. We are looking, that's our lead. Again, it crosses federal fiscal years, so we add money as it becomes available. It includes our lead testing, any lead conferences should they be held again. And then a lot of it includes our neonatal abstinence, prenatal care, car seat grants, things that will be added as funding is available, and we know those numbers.
Okay. So is disease control next?
Disease control, again, this is our Article 6 programming. You will see we do have expenses there related to TB. We maintain those, even though you won't see a lot of utilization of that, but we do have a considerable amount of latent TB that we follow. And with this year being such an anomaly, there could be a bump up in that. That also covers our clinic costs. We do have an agreement with Saratoga County and Dr. Del Giaco to provide clinic services to Washington County patients, which has worked out very well. Our Article 6 expenses are the biggest number there. That's, includes our rabies. We have seen increases in our rabies costs due to high copays and high deductible insurance plans. I think we've told you before that if we have an individual who needs post-exposure treatment, they're to incur no out-of-pocket expense. So in some instances, we've covered that high deductible for the year in order to get the treatment secured for them. So those have been things we've struggled with. It includes our sharps containers and our sharps disposal in that line. That's pretty much disease control, unless you have any specific questions.
No, I think we'll move right along here. Everything's pretty much reasonable and in line with where it's been, and I don't see the board lighting up with any questions, so I guess we'll just, we'll help you move along through it, so not to slow you down.
Sounds good. 4059, let me go to our revenue. Again, this is based upon the number of children. This is our 0 to 3 preschool special education program. Pretty similar there again.
It's just driven by the numbers of people that are in
numbers dependent. Yep.
Okay.
And really pretty much the same with expenses. The high cost areas are certainly our tuition, our expenses related to services. No big change. Any transportation we have of the younger children are all included in that.
Okay.
And then finally is WIC 4082. This is a federal grant, and basically they spend what they get. The federal fiscal year for them is 10/1 to 9/30. So again, it crosses years and it's on a different year, budget year than we are. The change you'll see in the .4, the .1 or the .4s is there's no carryover allowed this year. In past years, if they've had unspent funds, they've been allowed to carry that money over into the next year's spending. And this year, they're not permitting that. So that's why you see a decrease. And then as far as expenses on page 75, again, they're pretty standard. Their .1s include the longevity and steps that we're anticipating. And just, carrying on with their basic programming.
Dues and subscriptions is a bigger number.
Dues and subscriptions, yes.
21,000 from 300 and something.
Right, that includes, they have different journals, but they also have, I believe that includes their WIC TV. They have a subscription that the state had recommended to them that was approved, I think, within the last couple of years, where they have a loop on TV. And that's a monthly subscription for them. That's included in that as well. So that's a bump up. Is language line in there? Yeah, the WIC channel is the biggest, and the different breastfeeding journals and nutrition journals that they're required to monitor throughout the year. But the WIC,
I know they funded all, but that's quite a bump up.
Yeah, and that was really a requirement, a strong recommendation of the state that they have that loop playing in their waiting rooms and in any areas where their participants collect.
Okay.
So that's a monthly charge.
Patty? Is WIC funding on line 40824612, is that actual product that they distribute? That we have zero funding for?
Oh, that's the carry forward.
That's the case.
Yeah, they don't allow anymore, which is interesting.
So, meaning?
You use it during the year and you can't move over any funds.
So where is the funding line for actual products like formula and things that are distributed? Is there a funding line?
The supplies, usually that's in their supplies. That's where breast fund, the 482.4030.01, that's their supplies, any promotional items that they provide to their clients, breast pumps, anything like that is included in that 0.4030.01.
Thank you.
Which is reasonably increased too, so, which is probably a good thing at that point.
Right, and what's the other thing you'll see this year is all of their funds were allocated. So typically in a year, they'll have a line item, I think it's near the end of their budget, for unallocated funds. So what the state has done in past years is allowed them to spend up to a certain level of their total, and the rest is included in something called unallocated. And then they'll get word from the state sometime in like the Q2 of their grant or Q3 that they can now spend their unallocated funds. And then we would come to you with a budget change, modification that spreads that where they want to spend it. This year, as in the revenue, they're not allowing those unallocated funds. So everything they thought they were going to spend or typically spend in each of those line items, this year has been already allocated. So we shouldn't be coming with that big modification to the different line items, Q2 or 3 next year.
Sounds like it. Very good. Other public health, is that all you had left?
I believe that was it, unless there's questions.
Very good.
So I just have an other. So we talked about it last cycle, going up to the board meeting, that we were gonna do a resolution to authorize a contract extension with Durham Transportation for the transportation of students in the, special education program. At the last minute, as Roger and I were discussing bringing that resolution forward, we kind of felt like it didn't quite meet the criteria for a contract extension because Durham increased the price 8.5%. So what I would request is a motion from HHS to go to finance, or no, I guess directly to the full board, to approve a contract, not a contract extension, with Durham Transportation for the transportation of students in the public health program. It's a technicality and a housekeeping thing, but Roger and I felt we should do it the right way. I'm not wild about the 8.5%. Durham sent us a justification, and they do have significantly increased costs in trying to provide the transportation in compliance with COVID. The issue we're facing really is that Durham is the only provider, and this is a mandated program. We don't have a choice. So as much as I'm not wild about it, I would request that HHS recommend approving the new contract and send that to the full board.
Do we have a motion from the Human Services Committee?
I'll move it.
Okay, we have a second.
Earl Wilson seconds.
And Darrell, thank you. Any discussion on that? Don, go ahead. Don? Yeah, unmute.
Was that, I didn't hear what you said, Sue?
I thought you had a question.
No, I was
No question.
doing
You were
second.
second. Great, thank you. Anyone else? Okay, all in favor?
Aye.
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 Thank you.
Thank you.
So are we all set to go from public health? Chris, you're all set?
Yep.
Okay.
You wanna do Ken real quick?
Yeah.
So we got
Thanks for getting me.
Yeah. It's a good plan.
Yeah.
I see Ken here. Ken, can you?
I'm here.
Thank you. Okay, so you're up.
Okay. Hello, everybody. We want to apologize for the earlier not being available. Had some difficulties. Do you want me to start right with the expenses, starting with the point ones?
Or we'll start right with revenues on page 17, unless maybe you don't have it.
Yeah, it's just a brief one. It's I'm anticipating it to stay at $10,000.
Okay.
The state aid from the. Say that again.
I said that's very good. I mean, that's short and to the point. That's what we needed.
Okay. And I suppose moving right along.
Yep.
So the point ones on the expenses, they're relatively staying the same. Slight increase for next year, just taking into account steps and longevities. Onto the point nine, I put request a small increase. That is only for to get a second cell phone for the office, so I can increase my availability. Right now, I have Mike Alexander working remotely in large, so he has the one office cell phone, so we can maintain contact with him. The postage line has stayed the same. I actually anticipate that decreasing over the next year or so as the office has become more digital. We're using less supplies, less paper, a lot less paper, and submitting things more electronically. With that, the office supplies other line I requested a decrease, small decrease, because we are using far less paper. The dues and subscriptions, I stayed flat, and that's just to maintain our subscriptions and dues with the American Legion, and our accreditations. The travel line and the education training staff development lines also stayed the same. The conference this year is supposed to be in Madison, Wisconsin. A lot of those decisions are still up in the air due to the COVID outbreak. And I know for initial accreditations this year, they did move online, so that would save some money. But at this point, I just can't make a solid anticipation as to whether or not the conference will be held in Madison in 2021, or for the advanced training, the continued education training, that was gonna all move online as well. And the last line, mileage and expenses, that stayed the same. We obviously didn't use nearly as much fuel this year because the transportation was shut down in large for many months, but that stayed flat as well.
Very good. Any questions from the board? So, oh, you got Al, go ahead, Al.
Hey, Ken,
Yes.
there was a pretty decent jump in your part-time line. Do you have something different going on there?
So Andrew DePaulo is the part-time driver for us. He steps in for Art Belden, who is our other part-time driver. So when Art is out or sick or is unable to drive for any other reason, Andy steps in, and that has also allowed us to expand to different days. We were only able to provide transportation to the Albany VA on certain days of the week. The problem with that is some departments, let's say optometry, they only see people on Fridays. And a lot of veterans need to go down there on Fridays, and Art wouldn't be available on those days. So we picked up those days so Andy could take those veterans down to the Albany VA and get their treatments as well.
Sounds like Andy.
So we're driving more days then?
Yes.
Okay, thanks.
Yes, sir.
Very good. Good job, Ken. Keep up the good work.
Thank you, Ken.
Thanks, everyone.
Thanks so much. Okay, we're gonna jump from, Tammy, I see you. Are you all set to go?
Hello?
We have Tammy and Gina both.
Okay. Yeah, what I'd like to do is start with Office for Aging, just a couple of program requests and updates. We do have a joint budget with DSS, so if you'd like, we can move into that very end after Tammy's update as well.
Okay.
Whatever works best for the committee.
Yeah, let's do the regular business first.
Okay. Okay, at this particular time, I do have an equipment purchase request. The nutrition program is in need to purchase 4 heated bags to replace existing vehicle hot boxes. The hot boxes that we have currently are over 20 years old, and they are no longer covered under warranty. The manufacturer also does not make this model or the style hot box any longer. Our department did reach out to Buildings and Grounds to see if they could repair our current hot boxes, and we were told that they just are not repairable by their department at this time. We found that the least expensive way to address this need is to utilize what we call heated bags. So at this time, I would like to make a request to the committee to purchase 4 heated bags at a cost of $360 each. The money is currently in our budget, and the total cost is 63% reimbursable using our federal Title 3C1 funds.
Okay, we have a motion to accept that.
I'll make the motion.
Okay, do we have a second?
I'll second it.
Sure, thank you, Paul. Any questions for Gina?
Yeah, question, Gina. Is this something that you're doing on a trial basis to see if you actually like this product, or is this something you're gonna switch over to, or where are we at there?
So at this time, we're very excited about finding this product, just because it is much lower cost than what we had seen in the past with other items that do pretty comparable work. Our biggest piece in it is that it is an item that keeps the food to proper temperature during transport. And all of the reviews on this product are very high, saying that this item will completely meet our need to keep the items at proper temperature. So I feel like moving forward, this would be an item that we would continue using. We also looked into the fact that, the bags that we're looking at come with a heated element to it. And so the bags, if the bags are still in good condition, then instead of replacing the entire bag and the heated element, we could do either or. We could replace the bag, or we could replace the heated element separately, which is lower cost.
Janet, do these have expiration dates? Silly question, just wondering. Do these bags 5 years?
Not that I'm aware of. I haven't read or heard anything about an expiration date. Hopefully there is some great longevity to the product.
Thank you. Okay, all in favor?
Aye.
Oh, thank you. Okay, next, Gina?
Okay, thank you very much. The next item on my agenda is talking about the COVID-19 ADRC stimulus funds. I've brought to committee a few times the NGA about the COVID ADRC stimulus funds. And at this time, I do have a plan in place. I wanted to share with the committee that in collaboration with DSS, we developed a plan to use 100% of these federal stimulus funds to offset a statewide funding reduction. The funds will be used to support consumer needs that are not addressed by typical New York Connects program areas. I would like to submit a resolution on this, amending the 2020 budget to recognize the COVID-19 ADRC stimulus funds by increasing the family assistance budget line, which is line A6109.4209 by $22,929. And in turn also amending the federal aid revenue line by increasing line number A6772.4489.08 by the same amount.
Move it.
Okay, do we have a second? Don, thank you. Any questions for Gina on this? Okay, all in favor?
Aye.
Thank you. Okay.
Thank you very much. Thank you. So that's all that I have for program updates. The next item on my agenda is the budget. And again, this is a joint budget between Office for Aging and DSS. So if you'd like, we could let Tammy present her program updates and then move on to the joint budget at the end.
Sounds good on my end. Go ahead.
Good, that's fine.
Okay, thank you very much.
Thank you, Gina.
Okay, can you hear me? No. Okay, sorry about that. Obviously, we've got some technical difficulties in here.
It's better now, Tammy.
Yeah, you're good.
Thank you.
So I do have some backfills to start off with, and these have all been reviewed with Melissa Fitch. We are currently down 2 caseworkers, and so I'm held on not filling one of them, but I would like your consent to fill one of the slots at this time.
I'll move it to personnel.
Okay, do we have a second to go to personnel? Okay, Paul? Don, thank you. Any discussion or questions for Tammy on this?
Why are we doing one and not two, or, I just don't know what your need is. I don't want to take away if you have a need. That's what I'm worried about.
Thank you for that. We do have, at this point, training is an issue, and so we do have a need in one program more so than another, where we're able to hold the one vacancy that we have. It's been my preference to not honestly fill any of them until there's adequate training available, because at this point, it's all online, and that's not the best way to train a caseworker, somebody that needs to be able to have great engagement skills and go into people's homes. However, at this point, our needs outweigh that concern, and we do need to fill one of them.
Excellent job. Thank you.
Okay. Did you vote?
Not yet.
We're good.
All in favor?
Aye.
Keeping us honest.
Thank you. Okay, keep going, Tammy.
All right. And so then otherwise, overall within the department, we're currently holding 8 to 9 positions open. One of them has been due to a long-term medical leave, and it's an account clerk assigned to the child support program. Until now, through the efforts of the accounting team, we've been able to cover the financial work in the child support area, but with the recent retirement of our accounting supervisor and the shuffle that we're going to have happening within our unit, the time has come that I really do need to seek a temporary backfill to that child support account clerk position. So I would be doing that as a temp.
Okay, move that to personnel too.
Yeah. Brian moves it. Do we have a second?
Is it a backfill of an existing position, or are we creating a new temporary position?
Temporary position. The person that holds the slot on a permanent basis is out on a medical leave.
Okay, so this would be you'd be removing a new position to create a temporary position, right? That's what we want to do. I will make sure that when we get next week, we know exactly what we're doing.
You're just adding a temporary position, is all you're doing.
Thank you.
I'll know that.
Chris or Matt Hicks, even refresh my memory, but don't we have an authorization of the personnel officer when you have a long-term illness to fill this?
Yes, we do. However, we've had this come up twice now in the last couple of cycles, and given the discussion we had with the board maybe 3 or 4 months ago about the board wanting to take a closer look at all backfills given the financial uncertainty surrounding COVID, rather than exercise that authorization that the personnel director has, we decided it would be better to run these things past the board just so that everybody's on the same page and we're all exactly 100% clear on what's happening. So you're absolutely right. Personnel officer does have that authority. We've decided that rather than just exercise that, we would involve the board given the unique financial situation.
Okay, because it's what she's proposing would require us to change the staffing pattern that would then have to be changed back out again. It just seemed like a lot of work for a temporary fill.
Or the board could direct the personnel officer to exercise her authority. It accomplishes the same thing in my book. The biggest part of my direction is I want the board to be 100% informed and have a say in this. The mechanics of how we make it work, I don't particularly have strong feelings one way or the other.
Okay.
Thank you, Al. So, do we want to keep the motion, or do we want to change that motion and amend it?
If it goes to personnel, it can be decided, right?
Okay,
I think your motion is fine.
okay, thank you. Thank you, Debbie. Next?
Now I have 2 requests in the accounting unit.
Aye.
I'm sorry, Tammy, we didn't vote that time.
What?
We need to vote on that. So, all in favor?
Aye.
Aye.
Thank you.
Just details.
Thank you, all in favor, but Tammy, now you can go forward. Thank you very much.
Right. And you know what? If you want to just say aye on this one, it's good with me too.
See where she's going with this.
This might be a new one today.
We're waiting.
Okay, so I have 2 requests within the accounting unit. We've promoted a principal account clerk to the accounting supervisor position. We'd like to change the title that had been in place as the principal account clerk to a bookkeeper position. Instead, it's a decrease in grade, and so that will require a change to the organizational structure. So what I would like to do is add in a bookkeeper at grade 13 and reduce our organizational structure from a principal account clerk at a grade 15.
Move it.
Okay, Brian moves it. Do we have a second? Paul? Jay? Any discussion? All in favor?
Aye.
Thank you.
Ready.
Darryl, any questions? Darryl? Okay, keep going,
Oh,
David.
no questions, sorry.
Chairman Clerk, can I just make one comment?
Yeah.
So this is a perfect example of what I, for lack of a better term, refer to as families of positions. So I commend Tammy for the move that she just made. What I would like to ask the board is please remember this, because what we're trying to do is set what I refer to as terminal positions in a department. The terminal position for this slot is a principal account clerk. What we're doing to try and save money and provide a succession plan and growth opportunity for employees is when an opening occurs in one of those terminal positions, we fill it at a lower title that's in what I call the family. As this person, if their skills continue to develop and they're able to take on the job duties of the next title in that family, I respectfully ask that the board remember that the department head did this and grant the request to move that person up the ladder, because she could have kept it as a principal account clerk and bumped somebody right into there. It would have been the path of least resistance, but it doesn't accomplish several of the organizational goals that we're going for. So thank you to Tammy for doing this, and just a please remember to the board.
Well, I'd like to expand on that, because this should go to personnel at some point after the budget's passed, and we should look at this in its entirety as a policy type.
Here, love it.
And so when these things happen, the terminal families that you went, we could move, they would just be automatic. The problem is with that, is we always get told the big lie that this is cost savings. Well, it's not cost savings, it's making our departments better. So every time they say, oh, and we're refilling it at a lower grade. Well, no, you're refilling it at a lower grade to go back up the ladder to get your people to that higher level so that we work in a more efficient manner. So the votes for just saying we're saving money, they work, but it's not the true picture of what actually goes on. And so, yes, I commend Tammy and all our department heads for doing this, but I think if we can come to a policy where this is a natural flow, where this works all the time as a policy, would be a terrific thing to happen. So that's where I'm going. I think Tammy has a question.
Tammy has a question, but I also want to add something, Tammy, to it, what Frank just said. I also think that the security and support and strength within the department and the teamwork approach. So regardless of the money, I think there's also some strength building skills in there. So Tammy, you said you were going to say something?
I was just going to respectfully, perhaps not disagree with the budget officer, but add in that in addition to it really is some cost savings, it wouldn't have been appropriate for us to pay whatever employee we would promote at the principal account clerk level, because they wouldn't have been able to work to that level. We have to have somebody come in at a reasonable threshold for them to develop their skills before we could expect them to then work at that next higher level. So it is the succession planning that the county administrator had spoken of too, that is in play here.
Yes, and your point well taken. In the grand scheme of things, it's not about doing it cheaper, it's doing it better. But even though there is cost savings at certain points, I get that. But great job either way. Appreciate it.
Where there's a lot of other sides of the coin to discuss.
Oh, yeah, there's a lot.
There's a lot of debate, a lot of issues to come up, and a lot of
Yeah.
pitfalls considering the variety of departments in this organization. So let's not assume it's gonna happen the day after the budget's passed. We have to have a vigorous debate on whether it's a good idea or not.
Have faith, my dear friend from Glenville.
The philosophy standards.
So the main entrance is over there. You would talk to an officer, a police officer that mans the doors.
He's telling us how to get off the air. I know that.
Thank you for muting. Okay. Anyway, I think we're on to safe harbors.
No, I have one more request.
So well, keep them coming.
So again, because of the need for the effective functioning of our accounting unit, it supports both DSS and OFA. I'm going to want to fill the bookkeeper position as quickly as possible. And so as it stands, we have to hold off until you are able to adjust the organizational structure, but then I would like to be able to very quickly move to backfill that next position, which, due to the fact that this is an internal promotion, it's reasonable to anticipate that that would come from a senior account clerk title. So I would like to also ask for approval to backfill a senior account clerk once we have an opening in that title as well.
Move it.
Brian's moved it. Do we have a second? Okay, Paul, Don, thank you very much. And any discussion? All in favor? Okay, Tammy.
Well, so I'd like you to vote yes, but just in terms of discussion, I do want to say that ideally we'll be seeking a transfer in at the senior account clerk level or someone who's eligible for that from another department. If we don't have interest in that, we are going to end up then needing to change the org structure and then seek an account clerk person at that base level. So that again would be another change to our org structure, but I would hope that we're able to canvass for interest in the senior account clerk title and be able to let you all know what we need for the organizational structure before you would hold that next meeting.
I've put alligators in my moat accordingly.
Stay out of my office.
Around people.
So I think we need to vote, so.
Aye.
All in favor? Aye. Right.
And just one more comment. So this last request from the commissioner would be part of that discussion the budget officer talked about, and part of the families of positions would also be what I call cascading backfills. And that when we do a higher level position, it's almost always an internal, and that creates, in our larger departments, a bunch of vacancies and shuffling below it. And this is a perfect example where whether or not she's able to get an internal candidate or an external candidate is going to dictate which title it's ultimately in. But at the end of the day, she's got X number of people in the accounting unit with certain titles, and she's going to be at that number of people under those titles. There seems to me to be a more efficient way to accomplish that, and that's what I would like to talk to the board about.
Stay tuned. Coming in December.
Oh.
Matt, do you have anything to add since you're personnel?
We voted. We're good.
I don't think I can add anything productive to
Matt looks, Mr. Hicks looks thoroughly uncomfortable.
We tried this 2 or 3 years ago.
No.
Okay, we'll move.
Haven't you learned that I don't learn?
Okay, it's back to you, Tammy.
Okay. I do have a few purchases that I'd like to respectfully make you aware of having already been made. It was the Safe Harbor grant, which ends today because it's on the federal fiscal year. So we needed, and it's 100% federally funded. This isn't an incidence of just spending because it's there, but it's spending because it's there and we want to avoid spending someplace else. So we wanted to line up some purchases that we would be able to keep on hand here and store for future case-related needs, knowing that we have other funding cuts coming in other areas and wouldn't be able to buy those items at that time out of those funds. So we've purchased some car seats, lock boxes, an array of safety locks, things like that would be used in the home, head lice treatment, diapers, that sort of thing. And also we have found it beneficial in the past to provide calendars as a scheduling aid to our clients so that they can track their appointments for treatment and school-related and work information. So we ordered a supply of 2021 calendars through these funds as well.
So the shopping spree total was?
Oh, I know how much the calendars were. It was no more than 5,000, I believe, is what we had, and it was multiple different orders over a period of time that I had reviewed with the county administrator ahead.
Okay. Just trying to get the magnitude to the board, have some understanding.
There will be, I'm sure, at some point, vouchers coming through that will, the audit committee, I would think, would be seeing.
Okay, so do we have a motion to support the already purchased items from the safe harbor?
I'll move that.
Okay, do we have a second?
You got Dan Paul.
Thank you, all in favor?
Aye.
Thank you, Tammy, for thinking ahead.
Thank you very much. And I guess that's a situation of begging for forgiveness, so thank you for not making me beg.
Okay, so.
All right, so looking at our current year budget, I do want to let you know that though we were way behind in getting any settlements in from the state, we have, since August 12th, been receiving a number of various settlements. At this point, the last count that we have is over $1,700,000 that has come in since August 12th. But we have also, within them, experienced the 20% withhold in the areas of safety net, adoption subsidies, and Code Blue. And that was Code Blue spending from last season. So far, the total of the withhold is $55,000.
Now, is that just a withhold, or is that not coming at all?
What we have been led to believe is that if the feds come through and provide the funding to the state, that 20% withhold will then be
Reinstated?
yeah, sent back through.
Okay.
Okay, similarly, we've received notice of several allocations that we would have in previous years received much earlier in the year. So to roll through them and let you know that we have received them, there are things that we will have built into the 2021 budget as well. So one of the first things, though, is the CARES Act Emergency Solutions Grant, which I had asked for your support in applying for previously. That was 100% funds also that would be able to use over the next 2 years for homelessness diversion of people that would otherwise not be eligible for temporary housing assistance. That was the amount of $259,579, and we have received notice this week that that was approved.
Or you can buy a house and put them all in one.
What?
No, just kidding.
Okay. All right, we also received our foster care block grant, and that was $1,079,000, and that's actually an increase over last year by $70,000. In Title 20, that comes in two separate parts. One is adult protective and domestic violence services, and the other is called all other eligible Title 20 services, which essentially means anything that DSS purchases that isn't funded through another better funding stream. So that is an account that they give us a certain amount for, but is always exceeded just by the nature of doing business. The total of those two parts for the Title 20 was $97,389, and that is a reduction of $6,400 from last year.
But the CARES money is all new money, right?
The CARES money is new money, yes.
So should we be more scared of what lies ahead because there's more money coming, or should we feel better that they just sent it?
They're all separate pots and separate things that we're allowed to utilize the funds for. So to the degree that we can offset a loss in one area by a gain in another, we absolutely do that. In the end, I think a lot of this is going to net out, but it's all just a crapshoot, I guess, for lack of a better term.
Okay, thanks, Dan.
We did, although, receive an extra $21,000 in HEAP admin money, and that was related to the CARES Act for administrative funding. So that, again, talking about our final net, was definitely something that provided good assistance to us. That brought the total for HEAP administrative funding for the 2019 or 2019, what year are we in? Yeah, 2019-2020 HEAP season to $303,000, and that's about $30,000 more than what we had during the previous season. We've also received our New York State Child Care Block Grant, and that is $1,066,000, and that's consistent from what we received last year. We also received the same amount this year in our flexible fund for family services, which is $1,907,000. The thing that we were made aware of when the governor passed the budget for this year that would impact this is that the child welfare threshold was increased within the flexible fund for family services. So that threshold that requires us to move money from the flexible nature of this and use it only for child welfare, that increase was $89,000. So that is one of the things that allows us less flexibility in allocating funds towards salaries, and some of the special funds would be the type of thing that would hope to some degree be offset by the COVID stimulus money that Gina spoke of earlier, as well as the purchases that I spoke of through the safe harbor funds. And last, but certainly no less confusing, we received the Supervision and Treatment Services for Juveniles Program allocation. We call that STSJP. We received it yesterday, and that is for spending that starts tomorrow. A plan is required for that, and it is the largest funding stream that we use within DSS for our contracts with the Youth Bureau and Alternative Sentencing. The funding amounts are the same this year as they were last year, but the key in this is that there are two separate allocations. One is for STSJP services, and the second is for detention expenses. We are allowed or encouraged by the state to transfer money from the detention allocation to the STSJP category in order to provide more preventive services, with the caveat being that that's then the 68% match for the state to our 32% of local funding for any preventive services. So the actual way that this breaks down for this year and would be the same as last year, the STSJP before any transfer in is $41,107. The detention allocation, however, is $113,000. And thankfully, we rarely have any costs that would go to detention. So, and that's largely attributed to the services that are provided by the Youth Bureau and Alternative Sentencing. So we have in the past moved $61,354 from detention to STSJP to bring up a total in the STSJP to $102,000 at again, that 62% match, which when we then add in our 38% allows us to spend $165,000 for total spending on preventing foster care and diverting youth from the criminal justice system. Again, that is funds that is traditionally and almost exclusively passed through to the Youth Bureau and Alternative Sentencing. I expect that we'll follow a similar path this year with potential for us to expand on that also, knowing that we have lost, at this point, believing that we have lost the safe harbor funds. We still have people who have needs that were being served through that. So between that and some of the changes that are coming through the Families First Act related to foster care, I think that there's some more opportunity for some good work that we can do there, but that will be information that we bring back to the committee as well. An update, I believe at some point I notified you in April, we were first told that there were emergency allotments, I believe also associated with the CARES Act, that were being given to all people that receive SNAP, which is a Supplemental Nutrition Assistance Program. So anybody that was receiving SNAP that received less than the maximum allotment for their household side on a monthly basis received an emergency allotment. At that time, we were told it was just for March and April. And at that time, just for comparison, we had 3,442 open cases or households in Washington County receiving SNAP, and of them, 2,340 were receiving less than the maximum allowance. That happens when somebody that's in the household is employed and their income has to be subtracted out from the budget. So that could decrease what somebody is eligible for, perhaps leaving them with a fairly minimal amount of SNAP were it not for now this emergency allotment. So at that time, the average allotment that was provided was $169 for each of the households. So that meant that the supplement was over $395,000 for each of those 2 months. And since then, that allotment has continued through to September. So at this point, if I'm just using the rough numbers that I had from that beginning, that means that the county population has received an additional $2,767,000 in just the emergency allotment. Thinking about the enormity of that, it led me to check what our average monthly amount of SNAP benefit is that's regularly provided to the Washington County households. So without that emergency allotment, the last data that I have that's solid was from June, and there were 3,501 households at that time receiving a total of $1,005,000 in SNAP benefits. Again, that's per month coming into the families in our county.
Wow. That's impressive.
So it really is. Between the two, it seems to me that at this point we've been bringing, the benefit that's been passed through has been about $1.4 million each month in SNAP. And I think now we can talk about 2021 if you'd like to.
Well, sure.
So as Gina already said, and of course you know, this is the budget for both of our departments. And at the beginning of this meeting, somebody said that they just wanted to know like bottom lines about increases and decreases. So I can tell you about that, and then you can let us know if you'd like us to go line by line through the budget.
Yeah, or highlights. I mean, I kind of want to keep everybody involved.
Okay.
I mean, if they're pretty much right in line and the same, I don't know if we have to hit on each and every one of them, but if there's a change or significant change, or if the number stays the same, but it's significantly changed, what's in it? That might be of interest too.
Okay. So at this point, I'm going to tell you just that highlight, and then somehow Gina and I both have to share the microphone to be able to go through questions, but I think we can just do it from the phone that I'm using. So the appropriation request for the joint budget is an overall increase for 2021 in the amount of $1,585,000. But as Patty mentioned earlier, that included fringe that we had not in the past included, but we are this year. So that fringe was an additional $2,596,000 for DSS and $125,000 for OFA. So if that were not included, we'd actually be reflecting an overall reduction in cost of $1,136,000. Talking about revenue, it goes without saying that our requested revenue is down because our spending is projected to be down. So the revenue is down about $1 million also for 2021. So I'm going to share the microphone better with Gina, and would you like Gina to go through OFA accounts first?
Certainly.
Okay. Yeah, there truly are just a couple areas that I wanted to highlight to the board about this year's budget. As Administrator DeBolt spoke about earlier, you know, our revenue is truly projected based on the same 2020 federal and state NGAs that we've received. So our 2021 budget really kind of is flat, as he had stated previously. I'd like to take you to page 78. Okay, you'll see on page 78, line 6010.4400. I just want to emphasize to the board that this is the Office for Aging subcontractor line, and it truly gives a visual of the Office for Aging programs and services. As you'll see in that section, the highest appropriation is the MOU that we have with the Sheriff's Department for the production and preparation of our meals. Although the cost of our meals has increased in 2021 by 26 cents per meal. The overall total of meals produced is projected to be decreased due to a decrease in meals themselves by approximately 6,500 meals. This in turn shows on that line overall decrease in the 2021 projection by $9,916 when you compare it to the 2020 budget. The other area that I wanted to bring to the board's attention, also in that same section on the same page, is the budget. We have a budget line there for $27,000 for the possibility of CWI's meal delivery services in the 2021 budget. As, again, kind of showing you that we have made an appropriation of $27,000 for CWI, or subcontractor for meal delivery. This is truly because it's an unknown certainty when CWI will start their meal delivery services again. So currently, as you are aware, we're delivering our own meals due to the lack of CWI services. And so we're fulfilling that need with the part-time and per diem staff. So you'll see in the budget, in 2021 budget, in the area of salaries and wages, that the part-time and per diem staff, that we have a higher hourly salary rate there in wages because of this. So just to kind of emphasize that we have projected that CWI will be providing about 9 months of services in 2021, and so that's where that $27,000 amount came from. So if there are no questions around that, then I'm going to pass the baton over to Tammy.
Okay. Would you like me to start with the first page within the packet that has any DSS accounts?
Certainly.
Okay, so page 15. Bottom quarter of the page. There's repayments of medical assistance. That would be people who then make payments back to us, or perhaps we receive money through a lien on a home or something like that. We kept that flat. The repayments of family assistance. We are right now at what appears to be an abnormally high amount of receipts or repayments for 2020, but we kept that flat for 2021. Not being sure how that trend will actually continue. Incentive earnings with child support, we look like we're a little bit low right now for 2020, so we lowered our request in that revenue area by $1,000 for next year. Similarly, same exact trend with repayments of child care, where we also lowered by $1,000. On page 16, we on trend, we think we're looking pretty decent at this moment with safety net, so we stayed on trend there. Same thing with the repayments for emergency care for adults. Repayments of daycare, that's gone up. We think there was perhaps some sort of a glitch with the CARES Act allowing more access for families to daycare assistance, and then there had to be some other sort of a repayment. That's not something that I am entirely on top of right now, but that's the little bit of detail I would give you for why it looks so high for 2020. But we also have followed suit with our 21 request by increasing that. Intergovernmental charges, we decreased by $1,000. Continuing to move down the page, there's 6010, 2401.03, interest and earnings of the Department of Social Services. We trended that down by $400 to $1,000. Miscellaneous sources, we have gifts and donations included this year, and that is a result of the petty cash amount that, or accounts that we set up. I believe that was done during the August meeting, and that amount that's in there is money that actually exists in a checking account, and at the end of the year or the beginning of next year, I expect that we'll be looking to move some of that forward into the 2021 year. That actually pays for the cost of the food pantry for DSS and any unmet needs that our clients have. Staying with state aid now, 6010-3601. We stayed consistent with medical assistance. Based on the trend, we have increased what we have in it for our request on family assistance, aid to dependent children. Again, all of these due to trends at this point. The state aid for social services admin has been decreased, as has the state aid for child care. While the state aid for juvenile delinquent, we have increased a little bit, gave it a little nudge there. We went down for our state aid for safety net. I believe that that's because our spending has been down. So we would be thinking going down in spending, we're gonna go down also with the aid that we receive from the state. Emergency aid for adults, we also trended down by $2,000. And the same for daycare, we trended that down. We actually have received our allocations. I would have just spoken to you about that. Still on the same page. Federal aid for medical assistance, bumped down by $500. We stayed consistent for the family assistance aid to dependent children. And we bumped up just a little, by it looks like $35,000 in federal aid for social services administration. Staying in sync with the pages on page 17. Consistent with the federal aid for the food stamp program. For FFS, as I said to you before, we've received the same grant amount on that. Federal aid for child care, we bumped down based on the trend. That is a 100% funded category, so it's the same, it's neutral within our budget, whether we decrease that or increase that, as long as we do the same on our allocation side. Federal aid for safety nets, we stayed consistent. And I guess for anybody that is familiar with safety net, you would know that we talk about that just being funded through the state and the county. We get federal funding when it involves children in some of the households for people that have exceeded their 60-month grant time frame for temporary assistance. The adults are then categorized as safety net, but if they have children in the home, we do get the federal reimbursement for that. Federal aid for the emergency heat program, HEAP, we kept that flat. Services to recipients, we bumped up by $4,000 based on the trend. That brought our total revenues down, looks, by $800,000.
Well, really only 475 if you adopt it. 800 from the amended, but less than the adopted.
I'm sorry?
It's actually not that much when you compare it to the adopted 2020 budget. It's less of a difference.
Okay. On page 18, those are the aging categories. which Gina opted to skip over. So being the good child that I am, we'll continue on. Appropriations. Moving on to page 76 for social services. Is this what you want me to do, is to go through line by line?
You're doing good.
Line by line.
You know, or just, like I said, just hit the things as you see necessary.
Okay.
I mean, if, you know, maybe do the subtotals or something, you know, because if we're not off any difference in money, I guess it doesn't change anything.
So you only want me to go over the subtotals or the changes?
I'd say the changes would be the biggest thing.
Okay. We did increase regular earnings, our .1 accounts. That, of course, you know, would need to have been built in. We decreased the regular earnings part-time. That was based on our belief of whether or not we would need to use temporary employees for HEAP. I think we may be able to get by this year without any, so we may actually also realize the savings, even more savings there, that additional, the $16,000 that is left in there, we might be able to have it not be spent at all. The overtime category, we kept flat. On-call based on the trend, that's down $50.
That's fine.
Based on a calendar.
Becky says that's based on the calendar.
That's right to the point. Good job.
So that does put up, of course, our tally there for salaries and wages is an increase. That's what we had said at the start. Keeping the benefits in there, the state retirement is up.
Yep. You can skip those because we weren't in before. Go ahead.
Happy to. All right, moving on to 77 then.
Oh, you know.
So keep skipping benefits. Okay. We have the computer equipment. You can see how we broke that down. And this is stuff that we would have reviewed through with Terry McNall, a belief of what we need to be able to, just to continue to function as is. These are replacements of things that have really exceeded their lifetime, and we would be foolhardy to not think that we need to book any of this in at this point.
Yep.
And we did also, though, add in the soft phone licenses. I imagine that's something that has been talked about by other departments. My understanding, and Chris, I think, knows more about this than I do, this is something that will allow us to be able to better, more efficiently work remotely if we have to have a shutdown in the future. Am I close?
Yep, you're spot on.
Okay.
Good job.
All right. Another discussion point, I guess, just to put it in your court, we had booked in for vehicles last year at the $70,000. That was something that is being done, as you all are aware, to eventually roll over vehicles from the DSS pool into the greater county car pool. So at this point, we did not book anything in for that, but that's something that we do at your direction to do so. So that means we're down overall in equipment. No laughs there, huh?
That'll be short-lived, don't worry.
All right, so telephone, we're up, we just trended up $1,000 there. The contracted service, that's fairly new for us, and that increase is a result. Last year, we started for the first time using shredding bins, where we receive a bin, and we received, I think, 4 to start with, maybe 5, and trade them out every month. And that is so that our staff just puts their confidential shredding into that bin, and a company comes and takes that away to shred that for us. That was something that I think was done countywide initially. It was most utilized by DSS. And at this point, it's continued to be utilized to the point that we are also using it to offset the need to do the controlled burns through the trash plant. So we're ordering more bins at the times that we have a higher level of need to purge our files, and then putting that in for the shredding. So that's what that increase is about there.
Is that a savings overall though, without the burning? That's what I'm guessing?
I believe that it is. I toiled over that at one point to try to get an actual number on it. It takes into consideration several different factors. At the very least, I would say that it does not tie up people from buildings and grounds to have to go with our materials to the trash plant and then observe the burn.
Okay. That's worthwhile.
Yeah, some answers are easier than others.
But overall, Brian, DSS admin totals are just barely above the 2019 actual, and it's less than the 2020 amended. So her expenses in this department look to be actually down from.
You really wanted to move along.
Well, I mean, I'm sorry, Tammy, but I don't care about how you burn stuff. I want to know, is there big money in here we can work with? And the answer is no. You've got it pared right down where it's supposed to be.
That's right. What he said, Do you want me to keep going?
Chairman's lost control again.
Did you ever have it?
The numbers are there.
Yeah, it's just according to what detail the board wants. I don't want to hold back any information that they want. That's all.
I'll bring to your attention that the Medicaid number, what to book in for that is something that is toiled over every year. This year, there's been so many things in flux. The fact that our payment for our weekly share went down this year, again, related to the CARES Act funding. So I took some sage advice from another commissioner who has been around the block several more times than I have. And we booked for the first 13 weeks of 2021 at the current rate that we are paying, and then booked for the next 39 to be at the rate we had paid before that decrease came into place. So that's how we've derived that number. That's $6,100, $42.90. So it is up slightly from what we had for 2020.
I remain cautiously optimistic that if there is whatever it would be at this point, fourth CARES Act, that our rate will stay at what she's budgeted for the first 13 weeks. There seems to be some consensus of that, what passes for consensus these days. So I went back and forth. I tried to beat Tammy up a little bit over this number, but she gave me the credentials of the commissioner that she stole it from, and I couldn't argue with those. So she's got a safe number in there. I'm hoping it may be lower.
I'm glad you brought that to our attention, Tammy, so we can beat up on Chris later if he's wrong.
That it's 100% local funds. So if you blow it up thinking to be on the safe side, and then you don't end up having that be the reality, you've just taxed people and you didn't need to. So trying to take the cautious path and come up with something that seems slightly based in reality or educated guess.
Did you have a question?
Must be he does.
Yes. Al?
So, and one thing I just want to remind the board of too, lately you've heard a lot of conversations again about the Affordable Care Act. If there is any kind of movement there, just remember that a big chunk of the reduction in the MMIS weekly shares was about, was it Chris, about 445,000-ish? The offset there?
Yeah, about $500,000.
So just, it's one of those things that if the Affordable Care Act, if they were successful in removing that in its entirety, that would have a significant impact on our MMIS. So I just want to just kind of keep that on your radar. It's one of the things we kind of forget is in that formula.
It's been a few days since Al brought those storm clouds in. He was making up his quota.
You know, we had rain all night, so they're back.
I hate to disappoint, Mr. Hicks.
Yes, hey, that's right. You're consistent now.
Anything else that you would like from me or Gina?
For now.
No, it's a good job. I mean, this is what we asked for, and this is what we got, and we really appreciate that from you and Gina both. I mean, that's, and all the department heads. This is, you know, kind of where it's the year we're in. And I haven't really discussed the plan from the top down, but I have taken it down to $1 million use of fund balance because that pretty much we have an opportunity of breakage and not using any fund balance in this budget. But at the same time, according to what we get thrashed with the governor on everything else, could be anywhere from $1 million to $2 to $2.5 million. And that may end up coming out of fund balance at some point, but at least that cushion's there that we don't plan on using any to begin with, and there would be a way to react without having to rip apart departments. That's kind of the philosophy that's behind this, is to not damage our departments or our ability as a county to function because we've set a budget that we can't work under. Instead, we've gone very conservative with a very good fund balance at the moment of around 18 million. So if the three-year trend, and I hope it's not a 3-year trend, but if the 3-year trend happens to be where we get battered and he takes away a couple million every year from us, we could still be at 12 million and still be in a very good shape. So I guess some may wonder why the numbers are so low, or whether I asked or directed that we get to this point. But I think by doing this, the fiscal health of the whole county should be better in the long run as we move forward and try to realign how we bring back our capital plan and things like that, because right now that's somewhat non-existent. So this is all part of that big measure, and you know, when you have social services in here, one of our biggest departments handles a lot of money, and you see what they can do, and right down to our smallest departments and what they can do. Everybody working together, being on the same page, the same team, and trying to get there with doing the least harm to our employees and to our departments, and you know, for what we can do for our citizens and constituents. This is a big deal, and I thank everyone immensely for this. I mean, this is the first blush. We're nearly through everybody now. We're getting a lot further along anyway, and I think our goal is there. It's in sight, and it's just what plays out with the governor, but I think we're going to have a budget passed before the governor lets us know what he's doing to us. So we have a roadmap of how we can contend with that and not blow up our departments, and that's exactly what I'm after. So I appreciate all the work you've done, and I hope you appreciate my philosophy on how we're trying to get there.
The proof is in the pudding as far as like the breakage, you're talking about that. We did an updated chart, and just from people resigning and being replaced by people that would come in at different rates for 2020 so far, we had over $100,000 in breakage. And then when you consider the positions that we've held open instead of backfilling them since the pandemic really, you know, in our austerity budget philosophy was really enforced, we are now projecting that to be $191,000. That's a savings in the .1, and that's just for 2020. If we move,
now, with that being said, Tammy, would that also, that's included with the COVID payments in at time and a half?
Yes, it's all about, yes, absolutely. We would have already.
That's impressive.
Yeah, we would have been paying the time and a half out of our regular earnings as well, and so this is the net after that, and as you know, we're able to claim, through the DSS streams, and actually would have received, reimbursement back for that time and a half through our traditional streams. It didn't rely on, FEMA. So right now we have, we do have budgeted in 2021 to have these other positions that are currently open filled. However, we will not look to fill them until we resume regular business, because at this point we have a lot of waivers in place, and so that's how we're able to get by without these positions being filled. But when the time comes that all of the waivers go away and things go back to normal, if we ever see that again, we will end up having to fill some of those positions, but I will come to you at that time with those requests as well.
Greatly appreciated. Is there any questions for Tammy or Gina from anybody on the board? Go ahead.
I actually have two, Code Blue, closest places are now Saratoga and Albany. Is that true?
I'm sorry, I couldn't hear you well. I heard you say Code Blue, Saratoga, and Albany.
If you have people that are requiring Code Blue, you know, in this winter, would you send them to Saratoga and Albany? Is that the direction that they would go? We don't have one in Washington County.
Every county is required to provide Code Blue services. So if the temperature, including wind or whatever, wind factor, it goes below 32 degrees and somebody lets us know that they are homeless, we can't find an alternative for them, like they forgot that they had a couch that they could sleep on at their mom's or something like that, we would have to provide housing for them, even if they were not eligible for our traditional programming. Code Blue, being in the law, requires us to be able to provide for them. So traditionally, to the degree that 3 years is tradition, since Code Blue has been in place, we've received 100% funding for that. We submit a plan, and if they come to us, our first diversion for them, or the first direction, I guess, that we send them, is to the Open Door Shelter in Glens Falls. We work very closely with them, so we would use that shelter and then look to any of the other shelters. I guess Saratoga shelter would be the closest if they were not age appropriate for the Wait House. And then the last case scenario would be that we would use hotels for them.
Thank you, Tammy. The other question I have, I think, is for Gina. Gina, we have a lot of senior citizens that rely on landlines and cannot have cell phones because of broadband coverage. And what has happened that I found out is that there was actually 4 elderly people living by themselves that were without any landlines for about 5 days. Is there an emergency way to find out how people are not, you know, they can't reach out to anyone?
Are you speaking?
There would be no 911 services or any way for them to reach out for an emergency?
So I feel like there's multiple factors in that, that will certainly kind of stem around the phone service itself. You know, when you say use 911, I'm wondering if the landline is severed and there's no way to reach out, then most certainly that's an issue. I am aware of our department reaching out and expressing some concern about some folks that didn't have an operational landline, and fortunately we were able to get them, you know, cell phone services. But that's the other factor, you know, it's one of those pieces of looking back to if we have no, you know, cell service and the landline isn't working, then our intention would be to work with the individual and can have a discussion with them about safety planning. You know, those are, some of those areas are just out, you know, we try to work to come up with a plan, but we are technically at the mercy of, you know, companies.
Thank you, Gina. I'm trying to figure it out too, so thank you.
You got anything more on the agenda, or you?
We have other business on the agenda from anyone else for the Human Services Committee? Looks like everybody's good. So do we have an adjournment for Human Services? Or we are adjourned, let's put it that way.
There we
We'll pass it
go.
on to Brian.
Hey, thanks ever so much, everyone. It's been a great meeting. And we didn't even get disconnected by the phone, so we did well.
You did great.
So
Thank you, everyone.
we're now adjourned. Thank you.
Thank you. Thank you.